Welcome to True Health Tuesday. Yes, it is easier than saying and the truth will set you free. Okay, today I'm on vacation. For those people that can't see, I actually have shorts on. But up here it's official. Okay, so we're going to talk about the risk-benefit of certain therapies. Now, this will be live on Facebook, and my apologies to Facebook because it's going to be harder to see it. The guy that has been increasing the quality of the product, where you can actually see this stuff, is on vacation as well. So all of this stuff will be put on the Dr. B site, Dr. B VIP site, so you can download the information. And this has got to be shared before it gets ripped off. The risk versus benefit. Is there a risk versus benefit of every therapy on the planet? Yeah, absolutely. So all this stuff, now normally this is the slide I put on halfway because I've been self-censoring because the Ministry of Truth that is trying to change the public. Now this has been used for forever. Okay, the Nazis did a great job where you controlled the media and then you controlled the population. And now we're having our media, which I mean, the founders of our country knew that the press had to be separate, that they had to be protected. Okay, what they didn't find out or envision would be groups of people controlling all of the press, all of the media. And now we have a monopoly. So from here on out would usually be the information that I'd censor. And so if this is my last one that I could put on YouTube, you can get us from Library or LBRY TV. We're on BitChute. We'll probably be on, we got a Podesta site. So, if not, I'll overturn a box and be speaking in a parking lot. We've got, and so this is $2.97 a month, so about half the cup of coffee. And this one's for $19, but this one's got a forum, which is really important, okay, that you can share with people. Okay, so now, this is just a few days before Christmas. It won't be posted on YouTube until after Christmas. They're putting out an experimental vaccine that has a totally different mechanism. And what's wild is it has absolutely no liability like all the childhood vaccines, but it uses a brand new technology. And we're going to cover that technology so that you can actually make an informed thought. You can't make an informed choice because it'll be forced on you. Okay. But in the first 5 days, 112,000 doses, there were 3,150 impacts. Now you can get this information on the CDC website. So Ministry of Truth, please bitch at them, not at me. The CDC site, the ACIP, or Advisory Committee on Immunization Practices, COVID Vaccines Work Group. And this is what they found. Now that 3,150 people that had a reaction, it was called a health impact event. And that's an event that will make you unable to perform daily activities, unable to work, and require care from a doctor or healthcare professional. So that's about 3% of the vaccinated group. Now that's in 5 days. So there's something going on with this messenger RNA technology. So it's really important that we go over it. Don't worry about that. I can speak a lot louder than your phone. So what you got to do is you got to transfer information. And the way the body holds information is in this ladder called DNA that's spun around. Well, you don't transfer the whole DNA usually. In this particular virus, you're transferring an RNA. And since it's a message, it's called a messenger RNA. Now, here's the problem. You're getting a foreign RNA or foreign protein strand. That means that have you ever heard of an allergy? What is that? It's an abnormal recognition of a foreign protein. That's what an allergy is. It means that your body is designed to function in our environment. But if you get a foreign protein, the body knows that it has to mount an immune system response. So, and there's DNA viruses or pathogens. There's RNA viruses or pathogens. Now, the problem is what they want to do is turn that cell, that human cell, into a virus-producing factory. Now, you might think, well, that sounds kind of stupid. Okay? And you might think that. And you might be aware that the animal studies that did this, and luckily in this trial, in order to facilitate the speed of production, they eliminated the animal trials. But if you look at the old animal trials, just about 100% of them died. Why? Because they got this stimulus to their immune system. They actually had this thing injected in. Now, because we're going to nerd out on the Dr. B VIP side, I'm going to go through the lipid nanotechnology, or it's really, really small stuff that's able to get into the cells. But it's really, really dense tissue here. So you got a problem. So you got this foreign protein strand or foreign messenger RNA strand. So here's the problem. If you get a foreign protein floating around in your bloodstream, your immune system immediately responds. And so they want to calm that down. So they found out if you wrap this little piece of protein in a fat layer, a really, really small fat layer, that it can get through the dense tissue, because when it's first injected in there, you're talking, there's not a heck of a lot of room. I mean, you've got lymph, blood vessels, connective tissue, muscle tissue, all of that. So you've got to inject that in there. So it's a really unstable molecule. Now, looking at some of the nanotechnology, the type of fat that protects that protein is important. And the size of that fat that protects that protein is important. And they've done a number of different studies on to see how big in size and the structure, because it's got to get through your body to the cell. When it gets to the cell, that fat membrane has to fall off so the protein gets in there. So it's got to be strong enough to get through one area, but be able to get inside of a cell to have the cell reproduce itself. So first, you got to get this protein in there. That's how you cover it in the fat layer. When the cell that gets in there, that protein in the cell, it's going to produce these things called spike proteins. And the spike proteins, and you got a healthy human cell, this virus particle gets in there through this brand new technology. The cell starts to produce these spike proteins that go out on this normal human cell. And so that the immune system can recognize it. Antibodies are going to recognize it, and they're going to have these little things that tell the immune system that this is a pathogen. Now, you might think there'd be problems with, I don't know, like allergies or something, because you're telling your own cells to produce cells or proteins that are foreign to your person. Let me word that different, okay? You're getting a vaccine that causes your body to produce proteins that are foreign to whatever you've ever produced. Okay, and so your body is going to usually attack foreign proteins. And you might think, well, wait a second, doesn't that mean the body's going to attack itself? Again, that's a problem. But, we're going to go into the 8 weeks of study that went beyond this. So how do you get the foreign viral spike proteins attached to your cell wall to stimulate the antibody production in your immune system without an autoimmune response? Well, this is out of sciencemagazine.org just a few days ago. Severe allergy-like reactions who received the COVID-19 produced by Pfizer may be due to a compound packaging the mRNA that forms the vaccine's main ingredient, the science say. Polyethylene glycol has never been used in an approved vaccine before. And guess what? It still hasn't. Okay, this is an experiment. Okay, so this is not an approved vaccine. This was approved for emergency use authorization. So this is an experiment. So if you're getting the vaccine, you're in phase 3. And you've automatically enrolled in phase 4, which is looking for long-term side effects. Now, you might think, well, if this study has been going on for a long time, that we might have, they may have done a real study where they take a therapy group and inject them with this experimental vaccine. Then they take a control group and inject an innocuous placebo. And then a third group, which you do nothing. Well, that wasn't done. Okay? they were actually utilizing a meningococcal vaccine has the placebo group that had 5 different antigens. And you might think that's unusual. No, that's typical for vaccine technology. You're not going to expose a person to a saline placebo, okay, in order to find out what the effects are. It's called an active placebo. This way is supposedly with a known effect. So let's just take 20, 30 people here. Okay, I'm going to inject a meningococcal vaccine with 5 different antigens and see if you all have the exact same response. No. This is stupid. But anyway, the polyethylene glycol was used in this, in this, but is found in many drugs that occasionally trigger an anaphylaxis. Oh, interesting. So it's the first vaccine ever it's been used in. And when it's taken orally, not injected into your body, bypassing your number one defense called the skin, that it can have an anaphylactic response. That includes rashes, plummeting blood pressure, short breath, and a fast heart rate. Now, nanoparticles. And this is actually really cool because, we're going to nerd out on the Dr. B VIP site because honestly, listening to the science behind this, it's incredible on how the body communicates. And so here's part of the problem. Encapsulating the RNA package that can travel through the bloodstream and reach the target cells is quite a challenge, as you can imagine. Because the body is an immune system. Your immune system is thousands and thousands of years old, created by your mom and dad and relatives and the environmental stimulus. So your immune system is amazing, but it's designed to attack foreign proteins that haven't been tempered by digestion. And now we're injecting a foreign protein in your body. So you can imagine you have to encapsulate that with a certain type of lipid or fat. Now, endocytosis is how it gets into the cell. Then it has to escape the endosome and release its payload. Decades of work have gone into this. It isn't easy. The years of experiments on animal models have shown injected nanoparticles usually end up in organs that filter blood, liver, spleen, bone marrow, and kidneys. Wait a second. Could that be one of the reasons that when this mRNA or this nanotechnology was experimented on animals, that when they were exposed to the virus, that they all died of organ hemorrhage? Could it be? And could that be why they eliminated the animal studies as part of this, or was it just you had to hurry? Okay. An important precursor to the nanoparticle vaccinology, is basic research on small interfering RNA. Ooh, so that means that it's not the only RNA inside of the cell. There's small interfering RNA that's already set up in there. Okay, now a breakthrough prize, Nobel Prize, sRNAs can seek and destroy complementary strands of RNA. In essence, we can turn off any gene we want. So when they say this technology can actually alter your gene expression, and when you're listening to this, that's kind of like a real bad thing to say. Because if you're altering gene expression, you're literally altering how you can adapt to the world for forever. So what you're going to see is not that it's altering gene expression, it can cause gene suppression. And you might think that's a little nitpicky, but it's not, because it's a lot more politically correct to say you're suppressing certain genes than expressing certain genes. But if you know the type of genes you're suppressing, you're actually causing the cell to express. Don't worry about it. The trials went on for 8 weeks. Yes, this is the CDC site. 8 weeks of testing on healthy individuals. Now, are these individuals who have high blood pressure, type 2 diabetes, cholesterol, or the average 12 medications that the person over 60 takes in America? Are they some of the vaccine injured, or the kids, 54% of our population that has a chronic illness or injury? Were they involved in the study? But they went through 8 weeks. Now, it's interesting on this trial, and again, this is off the CDC site. How many people in here would like to start manufacturing while you're testing at the same time? Would that kind of, and don't worry yet. Okay, because you're controlling the testing. Okay, Boeing is making the plane that crashed, and they're going to look at the crash to tell you what the cause of the crash was. Okay. No, we have agencies in there to second guess it, but this is the CDC, and they're not testing the data. The company that is manufacturing this brand new novel product is also doing the safety testing, and they're presenting this to the FDA and the CDC, which hasn't really gone through it because it just had an emergency use authorization. And they have to do that because, frankly, you only have a 99% survival rate with this, with 80% of the people getting the virus recover with mild to no symptoms. So if you have a problem with manufacturing to produce this while you're still testing it, that might prejudice the outcome. I do too. Okay. Now, of course, what do they say? Get the vaccine. Let's get back to normal. Kinda, except it's never been tested to see if it reduces transmission. So that means that if you do get the vaccine, you have an experimental thing that has 8 weeks of study behind it, that we're not quite sure what's going to happen inside of the body, but you still have to wear a mask, stay at least 6 feet away from others, avoid crowds, wash hands often, follow the CDC guidance, which means, you can congregate in Costco, but God, no, not in your church. Yeah, we're accepting this. Okay, so this is what has to happen. You get in that package, that foreign protein, okay, that's just a sequence. It's not the whole virus. That's why they say it's safe. You can't cause any infection. It can sure as hell cause a reaction. Okay, so then it's got to get in there. You got to suppress some of the protein production, and then it produces this spike protein that's supposed to get to the cell wall. Now you've got a foreign protein poking out of the cell wall. How does that work? Well, it means that the body is going to start to recognize that. They'll build antibodies to it. Those antibodies draw in these T cells, which can actually damage the cell. Now it's okay because if the body kills your own cell, that releases more of this foreign protein that was just produced that can infect other cells. So you can mount an immune system response. Knowing, again, 8 weeks of testing. Now, knowing that this is really hard to do, okay, let's just look at the Pfizer one, because that's the most common, or the first one. Yay, baby, you won. It has to be held at 70 degrees negative centigrade. So that means it's packed in dry ice. So when they make this little nanoparticle, it is really unstable. And in fact, once you get it up to refrigerator level, okay, at around 2 or 8 degrees centigrade, it'll stay viable for about 5 days. Now, when I say viable, does that mean that it becomes less effective or less toxic, or more toxic and less effective? Or, the data's not really there. Now, at room temperature, it's less than 2 hours. And again, when it heats up, does that mean that it's more toxic, less toxic, or just, again, unknown? Now, you can't refreeze it, and it's intramusculature. Now, the symptoms that the FDA are looking for, now remember, if you bring this to the vaccine adverse event reporting system that's good at Harvard did a study, and they said it's around, they're catching around 1% of the vaccine damage. So, and you'll see this a lot. Yes, we did have 4 people that developed Guillain-Barré or paralysis, and this was a common thing back in the swine flu days in the mid-70s, that it's a vaccine reaction of paralysis called Guillain-Barré, but it also occurred in the placebo group. So it's not really known that it was from the vaccine. But again, what's the placebo group in this? You got the meningococcal vaccine with 5 different antigens. But we're looking at transverse myelitis, brain swelling, convulsions, seizures, narcolepsy, deaths, pregnancy and birth outcomes. Now, we know that there's a problem with some of the tetanus vaccines causing an alteration in birth, and we know that the human papillomavirus vaccine can cause primary ovarian failure, and we're seeing a lot of challenges with that. But here, and again, this is off the CDC site, okay? Healthcare considerations. They're talking about if you're going to vaccinate with this experimental product, okay, that's never been tested beyond 8 weeks, that you shouldn't vaccinate your whole staff. You should do it in stages. Okay, so this way, if they develop, the problems, then you won't be completely without healthy staff. Now, women are about 75% of the workforce. God bless you, man. I got 3 sisters and I can talk with one of them. Yes, because some have actually drank the Kool-Aid. Now, the data demonstrates a potential increase in severe maternal illness and preterm birth due to COVID-19 disease. You will see that that is not true, at least in England. Maybe it is in America, but it's not true in England. Okay, there's no data on the use of mRNA vaccines in pregnant women. So right there, if you were reading this off the CDC site, like I'm putting it up, you say, well, there's an increased risk of preterm birth and illness. What's the risk? Doesn't say here, does it? Okay, but there's no data on vaccines in pregnant women and breastfeeding women. So we know there may be a risk, but there's no data to support this novel medical intervention using foreign proteins surrounded by a fat covering injected into your body. Survey says, how many want to go for it? Okay, nobody raised their hand. Well, healthcare systems should work together, staggering the vaccination. Now, here's something. Interim considerations preparing the potential management for anaphylaxis at COVID vaccine sites. Anaphylaxis is an acute, potentially life-threatening, serious allergic reaction. Severe allergic reactions to any component of the Pfizer vaccine listed has a prescribing information external icon is contraindicated to the vaccine. Wait a second. So if you are allergic to any component in this vaccine, yes, I know, the vaccines has novel components that's never been used in any vaccine. So how do you really know? Baby, you gotta get it. Okay. So pick the least favorite member of your family. Or you could always strengthen the immune system with some things like vitamin C, vitamin D, and maybe actually work on that. It's an 80% of the people that get it have mild to no symptoms, and you have a 99% recovery rate if you're under 80. Anaphylactic reactions in persons receiving the COVID vaccine outside of clinical trials have been reported. Interesting. So there have been reactions outside of the trial. While these reports are further investigated, CDC considers a history of severe allergic reactions, such as anaphylaxis to any vaccine or any injectable therapy, has a precaution, but not a contraindication to the vaccine. How do you think that you should take this information? If you've had an allergic response, okay, like we get a vaccine damage kit in here at least a couple a week, okay, at least a couple a week. Okay, so should this kid, who's now 18 and he's a nonverbal autistic, should we try this on him? Or should you balance his risk of infection and risk? Observation period following. So they've got this worked out, by the way. Okay, so they're going to inject you, and this is according to the CDC. The current recommendations, the CDC currently recommends a person who receives the Pfizer vaccine to be observed after the vaccine period. I wish I could cover that up. Guess what? For 15 minutes. If you have a sensitivity, you're going to be observed for 30 minutes. And while they're observing you, they're going to have an EpiPen, some steroids, and a bunch of other stuff. Because early reactions could be a sensation of the throat closing, breathing, or wheezing or cough. Gastrointestinal could be nausea, vomiting, abdominal pain, diarrhea, cardiovascular dizziness, fainting, rapid heart rate, low blood pressure, hives, itching, swelling. And if that doesn't occur in the first 30 minutes, if you're sensitive, or 15 minutes if you're not, you're okay, baby. Wow. Wow. Medscape article came out last week. Okay. the U.S. Food and the U.S. Food and Drug Administration, and by the way, they were called the Chemistry Board before they were formed. Okay, they were the liaison from the chemistry industry to the public. Okay, so they changed the name. They felt the Chemistry Board was not, you wouldn't accept it. Stating that it's safe for people with a history of allergies, but not for those who might have a known history of a severe allergic reaction to any component of the vaccine. Again, interesting, out of Medscape. How do you know? What's the risk of disease versus the risk of the therapy? The therapy is novel. We know the risk of a virus. The warnings included on the FDA's information sheet for healthcare providers should not be given to anyone with a history of allergy. However, 2 United Kingdom healthcare workers with a significant history of significant allergic reactions had a reaction to the Pfizer vaccine. A 3rd healthcare worker had no history of allergies and developed rapid heart rate or tachycardia. A perspective on potential antibody-dependent enhancement of SARS-CoV. Now, this was interesting because, again, antibody-dependent enhancement, that means that if you sensitize a person's immune system, then you can get an overreaction. And this is the best way to explain this, okay? When I'm getting somebody with allergies, I talk to them about how we can desensitize their system. But now let's say, is anyone in here vacuumed? Okay, I know, vacuuming sucks, okay?
Yeah.
Okay, I thought that was good. Okay, so me as being the only boy in a family of 3 older girls, okay, I was the guy that vacuumed. That's man job. That's what I thought. Okay, but you take that gray gooky dust out of there. If you went like this, okay, what would happen? You'd cough, you sneeze, that's a huge amount of particulate matter, your eyes would turn red, and that would be a normal response given that volume. But what if you had 1 part per billion of pollen just touched, all of a sudden your eyes water, your throat swells up, all of this? That's a hypersensitivity reaction. It's an overreaction to that stimulus. And that's what an allergy is. It's an abnormal reaction to a foreign protein. That's it. Okay, I mean, we'll simplify it. So what antibody-dependent enhancement means that we've sensitized the immune system, and that's exactly what injecting a foreign protein does. And for this particular virus. And it's a general concern for the development of vaccines and antibody therapies because the mechanism that underlie antibody protection against any virus have a theoretical potential to amplify or trigger the infection or trigger harmful immunopathology. At present, there are no known clinical findings, immunoassays, or biomarkers that can differentiate between any severe viral infection from an immune-enhanced disease, whether measuring antibodies, T cells, or intrinsic host responses. So that means that if you get a response, there's no way to tell if it's from the vaccine. This is why when you look at the vaccine studies where they use the vaccine and the placebo, knowing that the placebo is an active placebo, you can't really tell. There's no way to check. Okay, the implications of our lack of knowledge are twofold. Now, this is out of Nature. Okay, first, comprehensive studies are urgently needed to define clinical correlates of protective immunity against SARS-CoV-2. Second, because of antibody-dependent enhancement of a disease cannot be reliably predicted either after vaccination or treatment with antibodies, regardless of what virus is the causative agent. It will be essential to depend on careful analysis of safety in humans as immune interventions as COVID-19 moves forward. Interesting. Are you confident that those systems are in place? If they're using the vaccine adverse event reporting systems, they miss between 95 and 99%, according to Harvard. And that's one of the systems they're using. Now, this one, FDA gives guidance on allergy pregnancy concerns for this particular vaccine. And this was again last week. Let's see if you're reassured by this. I want to reassure the public that although there were these few reactions in Great Britain, these were not seen in larger clinical trials. He's talking about some damage from those healthcare workers. Does that give you assurance? In the 8 weeks of trials, they didn't see this, but now that they're putting it on the public, they're starting to see it. The Pfizer vaccine is one we're comfortable giving to patients who have had other reactions, allergic reactions, besides those other than severe allergic reactions to a vaccine or one of its components. They're comfortable with that, so you should be secure. Yes, and submit to putting a face diaper on your face, okay, that has never been shown to enhance your immune system, okay, and there's a huge amount of bacteria on it. I mean, it's mind-bogglingly stupid. And the federal government will be supplying the vaccine administration sites with epinephrine, hydrocortisone, and other medications to handle the reactions. But I think we still need to learn more, and that's why we're going to be taking precautions. They're going to watch you for a half hour. We may have to modify things as we move forward. Now, this is the ingredients. And because a patient came up and asked me, they said, well, doc, what can we do? If I got to get the vaccine because, I want to keep my job, how do we detox? And I say, you can't detox. And if you look at this, there's no thimerosal. There is an adjuvant called squalene, which is kind of surprising they put no adjuvants. It's in some of the vaccines, and there's no antibiotics. So how do you do it? How do you detox? Well, you can't, because it's actually getting inside of your cells. It's altering the expression of your proteins. So now with special populations, persons with underlying medical conditions, persons with immune compromising conditions, including HIV and those taking immune suppressive medications. They may vaccinate those with no contraindications. Unknown vaccine safety and efficacy profiles in immune compromised persons. So they have to be counseled that. So let's say that you have had an organ transplant. Let's say that you've been diagnosed with HIV and you're not from Australia. The reason I say that is because they tried to do their own little vaccine program, because everybody wants to get on this, 7.8 billion person forced vaccination program. And their vaccine, they had to withdraw it from the market because a lot of the recipients of the vaccine tested HIV positive. Even they're using a virus in there for HIV, but, of course it was false positives, although, again, you don't have a long-term study, so you don't know if they're going to develop it later on or not. So can you imagine being the counselor? Okay, individuals should be counseled about unknown vaccine safety and efficacy in immune-compromised person. So you're sitting across a table with somebody, and they have some type of compromised immune system, and you have to counsel them with stuff that you don't know. You might think this is odd, but I was looking at this one thing. It's called VUMed, okay, and it had Paul Offit and some other, doctor talking. And they said, yeah, this can alter DNA. And Dr. Offit said, or I can't call him a doctor, he said, why is that always a bad thing? What if it alters your DNA so you get superpowers? And the other doctor said, wow, you're just a half full kind of guy, aren't you? That's a little cavalier attitude. Okay. Pregnant and lactating women. If a woman is part of a group, healthcare personnel, who is recommended to receive a COVID vaccine and is pregnant, she may choose to be vaccinated. Really, not in America. Yeah. You get the shot or you don't work. Now, this is out of Bloomberg, and it's interesting. It was a couple of months ago. Wants to transform the body into a vaccine making machine by harnessing human cells to become miniature vaccine factories in their own right. Instead of virus proteins, the vaccine contains genetic instructions that prompt the body to produce them. Those instructions are carried via the messenger RNA. Moderna's mRNA-1273 consists of a strand of mRNA that tells the body to produce the spike protein of the coronavirus used to latch onto human cells. If the vaccine works as intended, the body will start producing proteins soon after injected, prompting the immune system to react and build up the protective antibodies against them. How well the mRNA vaccines will prevent COVID-19, it remains unknown. No vaccine based on messenger RNA has ever been approved for any disease, and even in the final stages of the trial, until now, there is so little published human data to compare mRNA stacks up against older technologies. Interesting, isn't it? And you get people in there, yeah, I'm going to wear my badge. I'm going to get my vaccine card. Mind-blowing. Okay, so here's comparing the Pfizer with the Moderna, and you can see the lipid is the thing that's different. That fat covering around there to get by your immune system, but just enough so it can get in there. Now, does anybody think that God is producing this that's perfect? Okay, no, I know the platypus was just a collection of different parts, but the manufacturing can't make sure that each of these little nanoparticles is the same. If you check out our video on the polio vaccine, there was the Cutter incident where a lab was trying to do an attenuation or killing the polio virus, and they didn't do it, so they caused about 40,000 cases of it. Now, here's out of the UK. So if you're looking for facts, okay, the UK has a little bit of information on it, like children. Are they at risk? And this is a site to give doctors advice so they can communicate to the patients. It's not mandatory over there yet. Fewer than 5% of COVID cases amongst children, and they generally appear to exhibit mild disease, although cough, fever are the main symptoms in children. Preliminary evidence suggests that not only do children have a lower susceptibility to SARS-CoV infection, but they're also unlikely to be key drivers of transmission at a population level. That's not just the only study. Tremendous amounts of studies. In fact, they're saying in the entire world they haven't seen one published case of a child giving it to the adult. So does that mean all the online education that we're doing, the psychosis that our kids are going through, and can you imagine being an 8-year-old wearing a mask and telling you can't hug your friend? Mind-blowing. They go on to state pregnant women and neonates. And again, remember that thing from the CDC that said women are at risk? Well, that's only American women. Women in the UK are totally different species. Evidence to date regarding the risk of pregnant women and neonates following the SARS-CoV-2 infection is conflicting. Early studies did not suggest an increase in uterine transmission, nor worsening of any clinical presentation compared to non-pregnant adults. They respond the same, and it doesn't transfer to the kid. Isn't that interesting? A more recent systematic review suggested that pregnant women are less likely to manifest the standard SARS-CoV-2 symptoms, such as fever and cough, but may require support in intensive care. Severe infection in pregnancy is associated with increased maternal age, high body mass index, pre-existing diabetes, and chronic hypertension. Exactly the way it does with non-pregnant people. If you have comorbid conditions, viruses don't infect healthy people. You don't see an athlete getting struck down with this unless he's doing steroids to build his body up. Now, recommendations of my staff. The objective of occupational immunization of health and social care staff is to protect the workers at high risk of exposure who provide care to vulnerable individuals. Although there is yet no evidence on whether the vaccination leads to a reduction in transmission, it may have a small effect on major additional benefits for the staff who could be exposed to multiple vulnerable patients and staff. No evidence, and this is the CDC and the UK, you get your shot, there is no evidence that it protects you in any way. Could reduce some symptoms. You might be able to travel because you'll get a vaccine card, a badge of courage, and then you could walk around with more of a smug look on your face when you're wearing the mask. Although no data for listen to the cavalier attitude of this. Although no data for co-administration of the vaccine with other vaccines exists, in the absence of such data, first principle would suggest the interference between inactivated vaccines with different antigenic content is likely to be limited. In English, that means if you're wondering that you could shoot this vaccine with other vaccine, there's no data on that, but it's probably going to be okay. There is no evidence of any safety concerns, although it may make the attribution of any adverse events more difficult. So if you're injecting 2 shots, which one caused it? So if we go next door to Shooters and you have a shot of vodka, a shot of whiskey, and a shot of gin, okay, which one caused that stumbling effect? There's no known risk giving an inactivated recombinant viral or bacterial vaccine or toxoid during pregnancy or while feeding, since inactivated vaccines can't replicate. They can't cause an infection in either the mother or the fetus. Are you comfortable with that, knowing that it's going to cause your cells to produce foreign proteins? FDA guidance. The FDA information to healthcare professionals notes that available data on the Pfizer COVID-19 administered to pregnant women are insufficient to inform vaccine-associated risk in pregnancy. So pregnant women are not at more at risk than any other person. If they have comorbid conditions, they are at risk of just like every other person. But nobody knows what it's going to do to the baby, what to the fetus. Is it going to help the outcome with it? And just for the cavalier attitude of the bastards that are recommending this, and I truly mean that, okay? They could not possibly have fathers to do this something that evil, okay? So if you're looking at this, ever hear of thalidomide? Okay, great one. Helped a lot of pregnant women with nausea. However, the babies came out missing limbs. Okay, and it can affect a couple of generations. We don't know that. It's not known. Okay, again, for a virus, that if you're under 80, you have a 99% chance of not dying. It's so deadly, they have to test you with a PCR test that's not utilized for diagnostics to tell you you're sick. And, God, just mind-blowing. Okay? If you actually catch it, that means you have to have a weakened immune system. There's not a 100% susceptible rate. You have to earn viruses and colds. Do you remember back last year? Okay, if you achoo, no one's going to say, wow, who gave it to you? No. You say, man, it's sugar season, we've been doing cookies like crazy and I'm stressed out about all the relatives, it's the winter time, low vitamin D. No one's going to say who gave it to you. Think how psychotic that is. Available data on the Pfizer administered pregnant women's, yeah. Data are not available to assess the effects of this vaccine on breastfed infant or milk production. It will be some time that providers will need to consider on an individual basis. Just mind-blowing. This is the disease that has rushed this novel vaccine technology to you. That's the percentage of life, not death. Now, when they say comorbid conditions, I talked to a guy in Home Depot, okay, and he was asking me, he said, well, what about the 300,000 people that died? And I said, well, in America, there's on average 7,700 people die every year or every day. Then that means about 2.8 million, you get 330 million people together, and in one group, and you have about 2.8 million deaths per year on average. So if this really is 300,000, which I highly doubt, because on March 24th of this year, they said, it's not really that you died from this, it's that you died with this. And then it wasn't even that. Okay, you could have been run over by a bus, but if you tested positive, you died with this, okay? So dying from it, that means a healthy person, somebody without symptoms, actually catching this and dying from those respiratory problems. Okay, the CDC came out and said, well, they were about 94% off. Okay, so you could take that 300,000 and multiply it by 94% and wipe that out. It was 18. But even if we take that inflated 300,000 people that have supposedly died from it, that's about 10% of normal deaths. 10%. Now, last week we put on a letter that was retracted from Johns Hopkins saying this COVID is amazing. It has wiped out a lot of cancer deaths. It's wiped out almost all the flu deaths. It's wiped out heart disease deaths. It's wiped down a lot of the comorbidities. Why? Because even though they had, all of these different diseases, bam, that was on the death certificate because these doctors are told that. Okay, don't look at the date on this one, but just let me know if this sounds familiar. Medical centers are responding with extraordinary measures, asking staff to work overtime, setting up triage tents, restricting friend and family visits, canceling elective surgeries. I've been in practice for 30 years. It's been good 15 or 20 years since I've seen a flu-related illness scenario like this. His hospital is managing, but just barely, keeping up with the increased number of sick patients in the last 3 weeks. The hospital's urgent care centers have been inundated. Outpatient clinics have no appointments available. We had to treat patients in places we normally wouldn't, recovery rooms. The emergency room was very crowded, sick, and patients who just needed to be seen are given Tamiflu. California, particularly hard hit. Okay? Several hospitals set up large surge tents out of their emergency room to accommodate and treat the flu patients. Even the LA Times reported this week, emergency department standing room only. Some patients had to be treated in the hallways. A child dies. Now, any death is horrific. Any death. But by God, a child dying of the flu? Does anyone want to find out what this kid's history was like? Did he have any comorbid conditions? Was he one of those child from the wacko parents that don't vaccinate at all, that just raised him on healthy organic food, probably got him adjusted, and he was out there playing baseball and happened to get this? Okay, so again, you got to look at beyond the headlines. Nurses being pulled from all the floors. Almost every patient in the hospital has the flu, making their pre-existing conditions worse. More and more patients are needing ventilation due to respiratory failure. This was 2 years ago. Nobody shut down. My God. Now, this was a study done from Guinea-Bissau. 30 years ago, they actually went in. Oh, and by the way, there won't be any long-term studies on this, because what they've done now to stop this type of advertisement is they're vaccinating the control group. Okay, let me explain what that means. Guinea-Bissau, 30 years ago, or I think it's almost 40 now, they vaccinated with this DPT shot or diphtheria shot in a group, but they didn't vaccinate in the other group, so they had controlled population. They went back in there 30 years later, and they found out, holy moly, 5 times the amount of death in the vaccinated group, not from diphtheria, but from all the other causes. So what the Advisory Committee on Immunization Practice for Disease Control concluded, 3 years later than a causal relationship exists between arthritis and 2 vaccination combos. 3 years it took to find that. This gal was talking about, and she's still up, by the way. I don't know why they didn't wipe her out. Vaccines are not assessed for their effect on overall health. They are only assessed for their protective effect against a specific disease. Ask yourself this. Should everybody have the same dose of the same vaccine? Should women and girls get a different one? Should men get it? What about different histories? Or is it just one size fits all with this brand new technology? Vaccines train the immune system in ways no one expected. The U.S. has discontinued 66 different vaccines from reactions. This is page 1. This is page 2. You're right. This one, they found religion. It is perfect. What is a virus? It is not alive. It's a well-organized molecular parasite. Molecular parasite, that means you have to earn this. Earn this. If you're so healthy, they have to check you to tell you that you got it. We got to start smelling the what they're dishing out. Vera Schreiber. And I'd totally recommend you reading her book. 100 Years of Orthodox Research Shows that Vaccines Represent a Medical Assault on the Immune System. All the data that we have tonight, does it sound like it's a great thing for your immune system or an assault on your body? The fact is that many countries that call themselves free succumb to medical dictatorship. People are sicker and less healthy. A country which mandates vaccination is not a free country. It is a country of zombies who do what they're told by vested interests to intimidate them and use them to make money. Wow. So there's no pregnancy information, no long-term studies, no reactive studies. Placebo group was vaccinated after the 8 weeks of the study, so there's no long-term control group. In my group of oral polio recipients, I'm 60. Yes, Sarah, no, people are still alive after 60. Just settle down. The polio vaccine that I got increases my risk of brain tumors and non-Hodgkin's lymphoma because it was contaminated with SV40 virus that wasn't identified for about 30 years after it went out. All of this data will be on our site. If we are wiped out from YouTube and Facebook, please go to this site, okay? And I want you to get this because the handouts and everything are going to be in PDF form so you can share it and send it. You'll see the really cool handouts like this one where I detail out the brilliant technology of the 1300s and the brilliant technology of 2020. Both of them are nuts, okay? And please get out there. Support Del Bigtree at Highwire. Support everybody you can. Just look at alternatives, because when people are asking me, where do I get that information? I tell them from deleted sites. And they look, and then I realize how stupid that was. Okay? How can you find something that's not there? Okay, so give them actual information. That guy in Home Depot, he got my contact information. He got everything, because this was a thinking guy that I think is going to make a difference. So find thinking people and share this information. And Christmas is in a couple of days. Find your family, hug them, call them. If they're accepting of you non-mask wearing people, okay, hug them. If they're not, just send them a prayer, send them love, okay, because we got to bring them back. Thank you very much.